Look down at your feet right now. If you're a man over 45, there's a real chance they're holding a piece of information your blood work hasn't told you yet. Not a metaphor, not a wellness slogan, an actual physical signal sitting on your skin that most men walk past every single day without knowing what they're looking at. Here's the question this video is built around. If your liver has already started to fail you, would you even know? Not eventually, not in 5 years. Right now, today, looking at your own feet in the shower. Most men assume the answer is no. That liver disease announces itself with something dramatic, something you can't miss. That assumption is wrong, and it's wrong in a specific, measurable way. By the time the obvious signs show up, the disease is usually no longer early. Which means the real question isn't, will my liver warn me? It's, am I reading the warning correctly while there's still time to act on it? So let's find out what your feet are actually saying. Why this lands differently for Gen X. Your father's generation didn't have this problem in the same way. Heart disease, sure. Smoking-related damage, sure. But the liver crisis hitting men right now is new. And it's new in a way that specifically targets your decade. The dominant driver isn't alcohol anymore, though alcohol still plays its part, and we'll get to that. The bigger story is metabolic, a condition with a name most men have never heard, now affecting roughly a third to nearly 40% of adults in the countries you're watching this from. It tracks almost perfectly with age, peaking right in the 55 to 69 bracket. That's not a future risk, that's your current zip code. But here's the part that should actually bother you. Studies tracking real clinical data found that close to 1 in 3 adults likely has this condition, and less than 1% have ever been formally diagnosed. Less than 1%. Meaning the gap between who has it and who knows they have it is enormous. And you are statistically far more likely to be in the doesn't know group than the diagnosed group. Why you specifically and not your father's generation in the same way? 3 things stacked on top of each other. Decades of cumulative exposure to alcohol, medications, and a diet built on processed food and high fructose sweeteners that simply didn't exist at this scale when he was your age. A generation-wide habit of avoiding doctors unless something is already broken. And a disease that, for most of its course, produces almost no symptoms at all, until the moment it does. That combination is why this isn't a generic watch your health video. It's specific to you, your decade, and the particular blind spot built into how this disease behaves. What the feet are actually telling you. Let's get into the signs themselves. What's real, what's overstated, and what the internet gets wrong. Start with the one almost nobody recognizes by its actual name, spider angiomas. Small, bright red marks with a central dot and thin lines branching outward, like a tiny burst of red threads under the skin. Roughly 10 to 15% of healthy people have 1 or 2 of these, and it means nothing. But when several show up together, the picture changes. Research has found that multiple spider angiomas carry a specificity above 90% for chronic liver disease. Meaning when you see a cluster, it's pointing at the liver specifically, not just something vascular. For a long time, the explanation stopped at excess estrogen, which the liver normally clears and stops clearing efficiently once it's damaged. But newer research has added something sharper. Elevated levels of vascular growth factors and a molecule called substance P, both driving active blood vessel growth at these sites. That means these aren't just leftover hormone residue sitting on your skin. Something inside you is actively building them. Now here's the catch most foot sign videos skip entirely. The classic version of this sign shows up on the upper body, face, neck, chest, arms, not the lower leg. So if you're checking, check there first. Lower leg spider veins are usually a different story, more often tied to vein problems than liver problems. Worth noticing either way, but don't confuse the two. Then there's the itch. Specifically itching on the palms and soles, often worse at night, with no rash to explain it. For years, the textbook explanation was simple. Bile backs up, irritates the skin, you itch. Recent research has actually overturned that story. A landmark study found that bile itself plays a much smaller role than previously thought. The real driver appears to be a molecule called Lysophosphatidic acid, produced by an enzyme your body ramps up when liver function changes. Essentially, your liver manufacturing its own itch signal and sending it straight to your nerve endings. In one major study on a related cholestatic condition, nearly 9 in 10 patients reported this itch, and doctors under-recorded it constantly because patients didn't think to mention it. So if your soles itch at night and there's nothing to see, that's not dry skin. That's worth a conversation. Swelling is the one that gets dismissed the fastest because every man over 50 has had a long flight or a long day on his feet and blamed the swelling on that. But persistent swelling in both ankles, especially paired with any weight gain around the middle, is one of the strongest, best documented liver signs that exists. It happens because a struggling liver changes how your body manages fluid and protein. Pressure builds in the vessels feeding the gut, and fluid gets pushed out into the tissue with nowhere efficient to go. This is a serious sign, not a monitor it sign, a get it checked sign. Now to the fingernails and toenails, because there's a finding here that's almost 100 years old in the medical literature and still gets ignored. It's called Terry's nails. The nail bed turns pale, almost white, like ground glass, with the usual pink crescent at the base disappearing and only a thin, darker band left near the tip. Older studies found it in up to 80% of severe liver disease cases. It's not exclusive to the liver, heart and kidney conditions can produce something similar. But on a man with other risk factors, it belongs on the checklist, not off it. Here's where we need to correct the record because a popular claim circulating online deserves a direct answer. Plantar fasciitis, that stabbing pain in your heel first thing in the morning, is not a liver sign. The evidence doesn't support it. What the research does support is that plantar fasciitis and liver disease share a common root cause: excess weight and metabolic dysfunction. So if you have both, your feet aren't sending you a liver message through the fascia. They're both downstream of the same cause. That distinction matters because chasing the wrong mechanism wastes the only advantage you have: early action. And one more correction because it changes how you should actually think about all of this. Cracked heels, hot feet, foot odor, these get repeated constantly in liver warning content, and the evidence behind them is thin. Cracked heels are almost always mechanical. Dry skin, standing all day, ill-fitting shoes. Treat them as a foot problem, not a liver alarm. The signs that actually carry weight are the swelling, the itch without a rash, the nail change, and the angiomas. Everything else is noise dressed up as signal. Last piece, and it's the one that gets the least attention despite mattering the most: burning, numbness, or tingling that starts in your feet and creeps upward. In a man with any combination of heavy alcohol use, prediabetes, or undiagnosed liver disease, this pattern shows up constantly, sometimes affecting more than half of men with significant alcohol exposure. It doesn't always mean your liver is failing directly. It often means the liver, the blood sugar, and the nerve damage are all part of the same downstream chain, started by the same root cause. If your feet have started feeling like they belong to someone else, that's not a circulation quirk to ignore. That's a chain reaction already in progress. What to actually do with this? So back to the question we opened with, would you know if your liver was already in trouble? Now you've got a real answer, and it's a useful one. Your feet won't diagnose you, but they will hand you the reason to get checked before the disease decides to announce itself on its own terms. Here's what actually moves the needle, in order of how much it matters. If you notice ankle swelling that doesn't go away by morning, palm or sole itching with no rash, new pale nail beds, or feet that have started burning or going numb, that's not a home remedy situation. That's a phone call to a doctor and a request for basic liver blood work, the kind of test that takes one blood draw and tells you more than any internet checklist ever will. And separate from the warning signs, there's one piece of this research that deserves more attention than fear alone: the most consistently supported intervention for the underlying metabolic disease driving. Most of this isn't a supplement or a detox. It's the combination of cutting back on processed sugar, specifically high fructose corn syrup, which multiple studies link directly to liver fat accumulation, paired with a lower carbohydrate eating pattern and some structured time-restricted eating. Multiple controlled trials have shown measurable improvement in liver fat and liver enzymes using exactly that combination. No miracle required, just a direct hit on the actual cause. You don't need to memorize every sign in this video. You need to remember 3: swelling that stays, itching with nothing to scratch, and feet that feel wrong in a way they didn't last year. Notice those, and you've already done more than most men your age ever will. Because the real danger here was never the liver disease itself. It was staying quiet about it long enough for it to stop being early.